Hi everyone, welcome to part 2 of the Planning Framework series. We're talking about developing the macro plan in this little segment. I know it's not the most exciting, but they're key pieces to think about when thinking about the whole project altogether. So, important to think first, again, tying into the last lecture, about what health communication is and what it's not. So it can be an awful lot of things. It can help us advocate for change. It can help raise awareness. It can invite and create space for discussion. It can influence perceptions and beliefs, which is what we often think about. It can do an awful lot of things, including help to create a more receptive environment, building relationships, and sustainability potentially for bigger pieces of the puzzle. It cannot, absolutely cannot, work in a vacuum. If you work in a vacuum, you get sucky results, pun intended. It cannot replace what's needed for what we're advocating for in the communication. So we can't say go get a flu shot and then not have anything or anywhere for people to go to get a flu shot. So it cannot compensate for the absence of these services that are needed, or certainly cannot compensate for treatment or diagnostics and the like. And it cannot be equally effective in all aspects of the message. This is something we'll hang on to over the next couple of weeks, but important to recognize that you are going to catch some, but you're not going to catch all with one communication effort, even if it's a complex one. So we're going to go through developing the macro plan, which, remember, this is in a macro plan, you're really looking at the big picture. You're actually stepping away from health communication details, and you're looking at the overall overarching goals. So these steps that are here are helping us spell out what we do in what order, and we can talk about this in class about how effective we think this is, or if it may be problematic in the chronology that's listed here. So take a gander at these. We're going to go through each of them individually. So this is just a cheat sheet of all of them in one place. But first, we need to start with an analysis of the program. There's many ways to do this for communication efforts or public health or community health education efforts, programs in general. One really common way is to use the precede proceed model, which I'm guessing most of you heard of from other classes that you've taken. But we work the first 4 phases where we're really thinking more about the diagnostics of things. So we're looking at what's happening in the social environment, in the context, so going back to the ecological model, and all those various rings that are influential in directions that we can't even see. Also looking at the epidemiological diagnoses. So what are the data saying? What do we know? What do we already have evidence of? And then looking at the behavioral and environmental diagnosis. So what are people doing around this issue? What have they already been doing? What are they not doing? Because sometimes the not doing or what are they not saying can be just as important about what people as what people are doing. So then we go into the educational and organizational diagnosis. So what are some of the pieces that would be reinforcing or enabling? What are things that set us up for success that are already in place that we can piggyback on? And then, of course, the administrative and policy diagnoses, so looking at the bigger picture. So if you look at those first phases, we're really kind of following the ecological model from the individual to the bigger hierarchy or overarching or all-encompassing circle, political, societal, systemic levels. And then on the second phase, or the proceed section of the precede-proceed model, we're looking at implementation. We're going to leave that be for now because when we're analyzing the problem, we are really focusing on those first 5 phases of the precede-proceed model. The proceed would then go into the implementation piece. Surprise. So once we have an idea and have a thorough analysis of what the problem is, then we can get busy in looking at what primary evidence-based interventions are available. So I've provided for you here 2 guides that give you systematic reviews looking that house evidence-based interventions. Now, to become evidence-based, it needs a significant amount of study and research and data collected to warrant that title. I want to just point out here that even if something does not have that title of evidence-based, it simply might not have enough evidence yet, but don't count it out. It might be a promising intervention. And certainly this means that we have to read the literature through and through and look in different avenues to see what is happening that's current that might not be published yet, But even if we find something in the systematic review, we need to go back to the primary literature. We need to understand the nuts and bolts. And oftentimes you can actually contact those who authored it to see more specifics about it. Most people are pretty generous with what they're doing because they want to see it replicated and learn more from the process. Of course, shocking, when you're selecting a primary intervention, you always, always, always have to consult with members and or at least leaders in the key audience that you are hoping to work with. That is the focus of the intervention. Don't leave them out at any point in this process. It will serve you well in the long run. And then, of course, in thinking about the evidence-based intervention, we have to determine if communication is the intervention or if communication is just a part of or in support of a larger intervention. Once we have those pieces in place, then we can start talking about identifying relevant audiences. So when we think about anybody in any kind of behavior, it is often supported and or influenced by people around them. So again, back to the ecological model, it's where our roots are. We can talk about the primary audience, so who is most affected by any particular issue. Let's just talk about childhood obesity, for example. So our primary audience would likely be children, right? Especially children who we're either trying to prevent from developing any sort of unhealthy weight issues or who are already struggling with such issues. A secondary audience are people who have significant influence over the primary audience, so easily jump to parents, right? And tertiary would have an effect on both, and that could be in a school setting, that could be working with grocery stores or folks who have access and can influence those behaviors of both the primary and secondary audiences. So oftentimes this process is referred to as audience segmentation. There's more details about that. Just wanted to introduce that idea here. You are segmenting the audience because you wouldn't have the same message for kids, for parents, and for teachers. You have to twist it and turn it depending on their vantage point and what they need from you. Also, sometimes you'll hear primary audience as not necessarily the key audience or the focus or target, but maybe the audience you want to approach first. So maybe in working with children around childhood obesity, we actually want to talk to parents first as opposed to kids, but kids would still be the primary audience, right, or the key audience of the whole operation. Once we move from there, we're going to choose a core communication strategy for each audience. So again, this is not a one-size-fits-all practice. You have to be mindful of who needs what and when. So we have to think about what strategy we could use. So we could just be working to engage folks. So interacting with individuals, having a give and take. This can be really helpful in building relationships and building trust or mobilizing communities. Certainly social media is the biggest platform that we think of these days when we're engaging in these ways, and we can establish trust through social media, although of course there's lots of ethical considerations. That provided a link here for CDC. They have a huge, expansive toolkit around social media engagement and development of messaging on there. So please check that out. There's a theme throughout here of thinking about the ethics of these things. If we're using social media, for example, Facebook, we have to think about our role and our boundaries, even more so, I would argue, than if you're promoting something or engaging people through more traditional means that we're accustomed to. We'll get back to that as we go along. From there, we need to choose a core communications, from there, engagement, we need to switch gears, and you could possibly just be focusing on information or informing groups. So this is providing data and answering questions. It's not just this outward motion, but it is having playback between you and the audience so that you're not just providing data, you're actually providing space to answer questions. So think about this in terms of informing, educating, and empowering, which is really what public health is all about. And then last option for a strategy that you might use for each of the audiences might be persuasion. So we're using theories about persuasive strategies often used in marketing to persuade individuals to adopt a particular behavior or action. Again, think about some of the ethical concerns that might arise when we're talking about public health persuasion strategies. Persuasion can be dangerous when we're pushing people into something that they might not want or putting our agenda first. Then you have to select the overall approach. So you have all these other pieces leading up to some of these bigger guns. Where we're talking about, is this going to be a focus on education or on policy or on social marketing? So when we're thinking about education, we're talking about opportunities where it's most useful, or when people already have a belief that what you are suggesting or what you're educating about is something that they know they will gain from. So it's almost like low-hanging fruit in that way. People are already willing and ready. So this is best when the audience has already expressed an interest, when if they have needs for just factual information. And of course, it always works best if the information is simple and clear. An example of this is the Safe to Sleep, which formerly was focused on SIDS. Unfortunately, that program is no longer in existence, which is a whole other topic of conversation. But when we're talking about sudden infant death syndrome, we usually have a very captive audience and people who want to do what they think is right and what we're telling them to be right in keeping their kids as safe as possible. Policy approach is certainly another piece, and this is helpful when the gains to the audience are not as clear and hard to sustain or are too costly. So we see these larger efforts like infant car seats, which, P.S., I grew up without ever being in a car seat, and I'm still here. So people of my parents' age, when car seats became a thing, were like, our kids were fine, right? Also, public smoking areas or not being able to smoke in restaurants, those are all policy pieces. Social marketing is in this gray zone, and social marketing has many definitions, but the one we're using here is that it's a design and implementation and control of programs aimed at increasing the acceptability of a social idea or practice in one or more groups or target adopters. Social marketing really is using marketing strategies for the greater good. So not for profit when you think of marketing in general, right? I think of end caps at Target that just make you buy them because they want you to buy them and the company wins. Social marketing is all about the greater good. So we're using similar marketing strategies like that focus on product and placement and all sorts of other marketing techniques, but we're trying to sell things for the greater good. A couple other things here for you to look at. There's a National Social Marketing Center in UK that has some very interesting things there that we can digest together. Once we're past that phase, then we need to think about choosing partners. So can't do anything in a vacuum, remember? We have to do this with a partnership of folks. So lots of approaches to choosing partners. It might be audience-oriented, so who is most closely related. You'll see this happen a lot when somebody gets a good grant idea, but they work in an academic setting and they need to pair with an organization because that organization already works with the very population that they have now permission to work with or conduct research with or what have you. Task-oriented or problem-solving is who can get the job done, who's best seated at the table that can help us get where we need to go, and let's get them there. Often thinking in these spaces if it makes sense to have health communication coalition. So it's certainly helpful when you have lots of people who have capacity to be helpful and have skills that move things forward. It can also be a bit of a challenge when you have a lot of people at the table and a lot of different ideas. So it's best when there's a shared vision. It's like any other group. There's some incredible things that couldn't happen otherwise, and there's some challenges to working in a group, no? Lastly is the SWOT analysis. So we're modeling and doing a SWOT analysis. I'm not going to spend too much time here on logic models because we're going to dig into them in class. And you've heard of them before, but really a logic model is just mapping out the program and the organization, how it works, and the underlying theory and assumptions. So you can see a visual display of who's doing what, who's bringing what to the table, and it really helps you map out your outcomes and spell out all sorts of pieces all in one document. I'm a big fan of logic models, so we'll go there. And here's a link for one as well. SWOT analysis is something I know that you have already heard about likely elsewhere. So just talking about the strengths and weaknesses, opportunities, threats. And in this instance, we're also adding an E, so it's SWOT with an E, to talk about the ethical concerns, because as I've mentioned throughout, there are ethical concerns potentially at each and every level of what we're doing here. So I won't belabor this. I know you've had some information about this before, and again, we will get into this in greater detail, but I want to place it here because the SWOT analysis is a useful tool. Always done best as a group exercise. Once you have that, you need to compare and contrast strengths and opportunities against weaknesses and threats and see what you need to do to the program to fix it, if it's fixable. So asking these kinds of questions, and again, thinking about the ethics and what are the roots of our decision-making process? How are we avoiding any ethical missteps? So I know it's a lot of information and a little bit of time, but we'll have plenty of time for questions in class. Thanks so much. See you soon.